people attenuate their activity based on what's around us. And so a point that I made in there is we do now and have always influenced each other around how we live and around our health in a huge way that goes way beyond what we've all focused on this past year around, okay, am I spreading a germ and do I have exposure?
All right. So Dr. Jesse Davis has been a practicing doctor of chiropractic in the greater Boston area since 2006. He is a postgraduate instructor for the Gonstead Methodology Institute focused on specific chiropractic adjusting using the Gonstead Technique. The Gonstead Methodology Institute named him their Chiropractor of the Year in 2010. He is a strong believer in having a healthy mindset and the power of chiropractic to facilitate healing. Dr. Davis was a previous molecular genetics researcher, starting in high school working on the genetics of strawberries with his father, who's a plant biologist and geneticist. His early research work before becoming a chiropractor has been published in peer-reviewed journals, including BMC, Genomics, and Nucleic Acids Research. He always enjoyed teaching and writing. He has consulted for the wellness and natural products industry for over a decade for outlets such as bonfirehealth.com, basmati.com, and the Innate Response of Megafoods brand. This has included educational material for healthcare providers and consumers, technical and regulatory writing, and product formulation. His work will be featured upcoming to chiropractors and their patients nationwide through Inception websites. He is also the author of Stronger First. Joining me now, I butchered that title. Stronger Than You Think. Joining me now is Dr. Jesse Davis.
Thank you, Stephen. Yeah, I'm excited to be here. Yeah, exactly. And it is somewhat, it's probably analogous to chiropractic first for the, pandemic era. It's been exciting to get it out, my first book out, and I have definitely had offices that have bought batches in and said, okay, I'm just delivering this into the patients. And put a chiropractic perspective forward for people. Yeah. In a time when really, we've all seen more focus on our health than, in any time throughout our lifetime. From a chiropractic perspective, also very, additionally beyond just people being sick and dying, we've also put this tremendous effort into our health. And then we're going to look back from a year or 2 years later and say, well, we transformed society to improve our health or protect our health. And we're not better than we were when we started, and arguably worse.
Yeah, it's such a key thing to note. And this book, that's why I want to share it, because the idea and principle laid out, it's so simple, but it really targets the way that we think, and not just, the timing of this book too couldn't have been a more critical time. You were writing this book in the thick of the pandemic and such, and just such almost a gutsy call, right? Because with everything going on, but also there couldn't have been a better time to really write this book to challenge the way that we think. And I do believe that once we pass the thick of this, I think looking back from more of a historical perspective about what happened, what could we have done differently, I think a lot of what you talked about is going to hit the nail on the head for so many Americans and really people all around the world, because there's just so much truth laid in. And I feel a lot of people don't necessarily want to talk about the truth or offer a different perspective for how to think about what's going on in the world right now. But just the ideas are so powerful in this book. So we want to dive into this a little bit. I'm glad to have you on. I've read through the book. I loved every bit of it here. We'll start in the beginning, really from the first chapter. You introduce your journey, kind of your beginning on your own health journey, if you will, starting, as a basketball athlete playing high school basketball, standing at a tall 6'4", measly 165 pounds, but you were told an athlete's worst nightmare. What was that?
Yeah. And it was something that it really came back to me over this past year. I was, finishing junior high school, going into high school, and it was really a healthcare experience that defined a lot of my life, where I thought, okay, I'm going to go in, something I have to do, and get this physical. And then on my way, in the real obstacle to playing sports in high school was just going to be competing. It was tryouts and making a team, and it turned out at the time to be very different. I went through this physical, and they said, all right, you can't play. You have to get further exams, and you're shut down until you're cleared. And it was this position of, okay, this whole aspect of my life is shut down. I don't know if it's ever going to come back. I have to wait essentially for doctors say so, or, you know, these sort of authorities to say, okay, here's what you can do with your life. And it was something that I just had to accept, but it was very difficult at the time. It was very difficult to do. I just said, hey, I know what I want to do. I know what I want to pursue. And not happy at all about being in this position of saying, okay, I just have to wait and be told, okay, here's when you're okay to go. And fortunately, not really a big spoiler in the book, but fortunately I was cleared. And all the tests were negative. But it was very, I think, analogous to this past year of saying, okay, there's a risk, shut down, wait, don't do anything. And I think the chiropractic patients and the chiropractic community were a group that had a great advantage this past year, because there's two aspects. You can look at your health and say, okay, well, you need to protect your health. You know, there's any number of systems. We can talk about a dozen systems that, you know, if there's a major issue, if there's some sort of critical failure, that's it. You know, to shut down your body, you know, it's life-threatening or function-threatening. But then there's this whole other aspect around your health where you don't want to just be bare minimum. You know, I was pursuing, it was just a high school basketball career. It wasn't anything stellar, but it was something that I wanted to pursue. I wanted to get better at. I wanted to compete, and that's life, right? No one wants to be, okay, I'm just surviving, and hey, all my systems aren't failing, which is essentially the type of care that most people are getting. You know, they're getting medical care and say, okay, well, you know, none of your systems are on the verge of failing, so give it another year. Where chiropractic provides this outlet to say, okay, let's try to maximize your health. Let's improve your performance. Let's improve your function. And that starts with even understanding that that's an option, which these days, you know, you get us, you know, the kind of 80-20 rule. 20% of people understand that and are pursuing it. And, the other, 20 to 80% aren't.
Right.
They're just leaving it up to chance, more or less, or maybe just putting a very small amount of energy into it. And so we put a huge amount of energy into reordering society, literally, this past year. And, you know, and you've probably heard it the same, you know, it was kind of a common theme to say, oh, well, you know, people don't really want to make changes. They don't want to, you know, do something that's hard for their health. They're not that interested in improving. And I just looked at this past year and said, well, okay, full on evidence that that's not true. Because we're willing to do it. We've shown what we're willing to do around our health. But we live in, you know, when we look at in chiropractic, and I know it's a pretty chiropractic audience, so many, you know, in terms of using outside in versus inside out, we live in an outside in society. And there's a lot of frustration, I know, inside the chiropractic community of this last year. Say, hey, you know, why is this all that we're doing? You know, we know, like here in Massachusetts, 98% of COVID deaths had a pre-existing condition where I am. And where was the attention on all this? And I didn't really leave myself out on that either. And you know, in terms of writing that book, I think that I would include myself, that we all, as across healthcare, and I'm really proud of what we do as chiropractors, but across healthcare, yeah, we have to do a better job of not just sitting on this sort of risk averse. Okay, you're not about to, you know, spring a leak tomorrow and explode, but let's really deliver a product is what people want, you know, in terms of how they want to live, and not just what fears they want to get away from.
Right. That's just, and it really is so much of the fear, like you said. It's a mentality of how we actually are thinking. And you mentioned that in the book, that it's like, look, regardless, we're not saying that, you know, we're not against this or for this, but it's really just understanding what are the facts and really understanding more or less what's true for yourself and what you can do to be proactive with everything now. Now, you mentioned the outside in and inside out approach. Let's talk about that a little bit, because maybe a lot of us, you know, there are a lot of chiropractic students here. There are a lot of people who are wanting to become chiropractors. So let's dig into that a little bit, because you mentioned so much great stuff in the book with how mainstream healthcare from all really realms, and it's really infatuating all of the different healthcare professions now with the outside in approach. But how does that differ from the inside out approach?
Yeah, it's, you know, it's a key part and focus of the book. You know, I go in, there's some pretty science heavy and research oriented and technical sections, but more than anything, I really worked hard to make it a short powerful, quick read that would reorient people from the outside in perspective, which says, you know, if our problems come to us from the outside, then the solution must come to us from the outside. And that's how they approach their health. And there's an aspect of that, but it also ignores where our health comes from, which is from our bodies. And that is the inside out approach to healthcare, meaning let's support and release the expression of that health from inside, and allow our body to express our health naturally.
Right.
And they are both, you know, we have a mental framework, right, of the world. And so we have to find something that works relatively well, and you have to be able to switch back and forth. And I really approached it in the book to say, okay, well, we have an outside in society that we live in. That's just the way it is. And, you know, we can blow your channel up and have millions of people watching this channel, and it's still going to be an outside in society. You know what I mean? Like, as big as, or, you know, I could sell 1 million books or whatever the case is and have this, you know, personally a huge thing. The society is still what it is. And that's what, as chiropractors, we're going to practice inside of. And so it's a matter of being able to reach people with that message and say, okay, I was here and now I'm here. But it's also a matter of, you know, we had this, like in this pandemic response where I almost, you know, it's analogous to like a mental subluxation. We just weren't able to switch. Like at some point, okay, we're responding. No one knew what was going on. It was, you know, a real threat, and, you know, especially to certain groups of people. But the flexibility of how we think and our mindset and how we approach our health needs to be there. Just like when, you know, you want a subluxation free spine so that your brain can communicate with your body and your body can communicate with your brain. Removing subluxation improves your flexibility in terms of, okay, your body can just adapt properly. That's, you know, the central chiropractic tenet. It was the same, I took the same approach of, okay, we need to be able to think properly to be able to respond. There's a threat to our society and to us as individuals, but how do you really respond to that threat and not just be in a panic? You know, we have to have a flexibility and an adaptability in our mindset, just like you need an adaptability in your body.
Right. Yeah, that's so good. And what I do like about this book as well, I mean, for those of you got to go read again, it's Stronger Than You Think. I'll make sure I link it down below so you guys can check it out on Amazon. But you did list a lot of great studies, and namely, you know, you had mentioned a lot just from more, again, of a historical perspective and bringing a lot of research that's come over the years just regarding how important the environment is for overall health and our overall function, and how we're meant to be exposed to a lot of different environmental factors, different viruses and bacteria, just to help regulate our overall immune system. You know, and more than that, though, it comes from, I think, through society, like you said, just through the outside in approach, like this drug or this surgery is going to help fix some sort of symptom without really recognizing what's the internal state of our own body and our functioning and wiring of our own physiology. You know, I'm in the outpatient clinic now. So I just had a patient, you know, my minute little baby years of practice with patients, but I've already, and this just highlights, I think, how prevalent and big of an issue this is in society. Like, I've only seen my few of patients, my minimal experience, sure yours with your several over decade years of experience of being a practicing chiropractor. You've seen it yourself consistently where patients are coming in and they're on this list of medications, or they come in and maybe they've been told that they need to have a surgery. I've had that already happen to me where patients were told they needed to have a surgery, and then through care were able to find out their body could adapt and heal. They didn't need to get that surgery in the first place, or that they were able to consult their physician and they were able to get off their medication because we were able to approach things from a more natural perspective. I think it just kind of highlights how big of a prevalent issue that is. But also what you highlight and what I really appreciated in this book was understanding where our thoughts and our beliefs actually came from with that. Right. And you had got what I loved. You kind of talked a lot about historical perspective from, you know, the Carnegies and sort of their infiltration with how that's kind of adopted and such. But how much do you think, if you want to talk about that a bit, like how much has this evolved, and why is it that it seems like this outside-in approach has kind of taken over, but yet that inside out approach seems to be kind of lost.
Yeah, it was a real eye opener. I drew a lot of content and what I've studied over 15, 20 years, and then also real specific study that I was doing writing for the book. Mm-hmm. And it really solidified a handful of things that, my perspective that, and the way I laid it out in the book was simply that the institutional approach is always going to be outside in, and expecting them. And like I cited this study or not even a study, but it was a whole, federal government, basically health promotion approach through the CDC and, something called Wise Womanist project that went on for several years and noble effort. They were trying to reach women and, saying, okay, well, they're underserved with cardiovascular issues. You think, kind of think the classic, okay, older man, he's heavy set and all these risk factors, but actually affects women more. And it was just beset with all these issues I talk about in the book. And it's like, okay, how do you take this institutional system that is literally doesn't even recognize where our health comes from? And then we're going to have them, okay, we're going to throw, I don't remember what it was, but if it's millions or billions of dollars, whatever these massive sums of money are, and say, okay, well, let's enact these health promotion programs. And they don't even know where it comes from. And so it really is up to us as individuals. It's a very, health promotion and, a vitalistic approach to health comes from the individuals. It comes from a grassroots approach. It comes from, I don't want to call it the fringes, but it comes from the periphery of these major institutions. And I remember being in your where you're at this point in your life, and even a few years prior, like I remember sitting listening to Guy Reekman when he was running the head of the president of Palmer College. Yep. When I started in 2002, and a book had just come out. Paul Zane Pilzer wrote this book called I believe it's called The Wellness Revolution, and it was all about how that was the next $1 trillion industry was delivering, that wellness aspect of healthcare to people. It had just come out, and it was really powerful. I remember listening to that, and similarly, it has expanded massively since then. I mean, that was 2002, right? The internet existed, but the level of content you could get was really pretty meager. It was not something that was, you're not going to fire up your laptop and transform your health. Where now, you're just still, a quagmire, and you have to get either lucky or good or both. But, you can get information to just transform your health in terms of making health improvements now, but it's still very much, someone like that. It's like someone like, just like what you're doing. So even on this channel is saying, okay, I'm going to turn on my laptop and get my microphone and just start talking. And you can go down the details, and the details make a ton of difference. So it's like the Gonstead work that you're studying and that I've studied throughout my career. The details make a difference, but the perspective is the first thing. And that's what, tens and tens of millions of people in this country and hundreds of millions of people around the world need.
Yeah. That's so true. And it's the way that we think about it, like we said. That's so true. I'm going through the book too, in chapter 3, you talk about what's inside you, right? Smarter than you think. And you really get into, again, starting to change the conversation from, okay, what's from everything outside of us from being an enemy to actually realizing, wait a second, no, our greatest source of what's going on from the outside is coming in from the inside. And you talk a great deal about things like, say, like the microbiome. And that's something that I've had a great deal of research in myself. And I've written, I think in my undergraduate, 4. I've written 4 research papers on the microbiome and in my senior thesis with it. So I started to learn this stuff in college and was absolutely amazed by that, by understanding the role of the microbiome and how that influences your overall immunity and health, and how they've realized, dysfunctional or inadequate levels of certain gut bacteria that lead to actually a large parameters of diseases, and autoimmune conditions. And that's something that really sparked my interest and really kind of got me onto this health kick and really understanding, wait a second, viruses and bacteria aren't necessarily a bad thing. And it changed that whole landscape for me. And you also cited a study here. I love this one. It was an epidemiological study showing that COVID-19 deaths have been mainly linked to hyperinflammation. So that's quoted in the Journal of Cardiovascular Endocrinology and Metabolism. What sort of role then, whenever I see this, and I know there's been a lot of information about COVID and, its effects on the cardiovascular health. Obviously, we know people who have more chronic health conditions are more prone to the virus than others. But what role does the inside of our health play in not just your overall immunity, but in handling something like the COVID virus that's going around right now?
Yeah, it's a great question. And it was something that was really eye-opening for me, that I think I knew and people know intuitively that, so here's a somewhat novel virus that predominantly affected people that were older, and especially people that were less healthy, that had pre-existing conditions, and especially in the, metabolic area or immune area, a handful of other things. But when I started going down this rabbit hole around how this works, the idea that that was the case wasn't as surprising as we might have thought, right? So we can go back, and there were similar, it was a new disease, but there were things that were similar in the past, diseases like SARS or lesser one known called MERS, and MERS especially, but both of them, there was data already that saying these things were much more likely to have serious health effects in people that were less healthy. And then as I pursued reading through this research, well, it was also the case for the flu. And, like if you have metabolic issues such as obesity, you're also much more likely to be hospitalized for a flu exposure. And they had found this all the way back even into the Spanish flu. And so, obviously there's a risk. There's a risk to COVID. There's a certain amount of challenging information that I put in the book for both sides of people, whatever your perspective is. I tried to take a very realistic approach, because I've had multiple patients that have had family members that have passed. And there've been, there are and will be people that will have real serious health outcomes. And then there's also the other perspective that says, wait a minute, we did this massive preparation, and then why did this information not get out from the beginning? It became apparent pretty quickly, but, we went back, and you can look back, it's almost a year ago now, it's hard to believe, but, mid-March, third week in March of 2020, and the whole country went to the grocery store to load up for weeks and weeks of groceries. And the idea, hey, that how strong and healthy you are has a effect on your risk, that never got out, on a way that all the other information did. And as I think, in my estimation, that was a major misstep. And still here we are. We know, as in the chiropractic community and people that pursue health and wellness, but there's still, very little action, I think, if you look at the bulk of the population around that.
Yeah. Man, that's so true, Doc. And it seemed to change because once fear got in about the virus, right? And I think a lot of us, including a lot of government officials and healthcare leaders, didn't know necessarily what to expect with this virus. Obviously, we expected the worst outcome possible to prepare to prevent deaths and sickness around the globe. And from a lot of ways, it's kind of like, who knew how to over-respond to this? I think we can all agree that to some extent, there was a lot of reactivity associated with fear from a lot of response from just, you can see it in the general public as well as some leaders as well. But then I do believe, and that's why, again, the perspective from writing this book in the thick of it was really incredible, because when fear is at its height, we can't see the truth, right? Because fear can oftentimes mask what is really true and what is really real. And that question again of, I believe it comes back to individual responsibility. What are we responsible for in getting us all past this together? And that conversation has seemed to turn, not for good or bad, but it's turned into what's the conversation now? Wear a mask, stay at home, socially distance, do what you can to proper sanitize. And again, and you outline this very clearly in the book, it's not to say what's right and what's wrong, what's good and what's bad, but what's missing from that equation is what are we going to do to benefit our own health, right? You had mentioned with guidelines, for example, right? We're always told to follow the guidelines, follow the mandates, do what the best we can. You mentioned you're in Massachusetts and outside Boston, they've had some of the strictest mandates and guidelines in response to the COVID stuff to try to be proactive, I think, for the good of the people. Yet your state has had some of the highest, COVID rates.
Yeah, it's true.
But
it's
true.
We have one of the most, medicalized, areas of the world. Really,
right.
Here I was just down there. Actually, I was donating blood, and I was just down there at the Mass General Hospital on Wednesday. And it's a small city in and to itself. The hospital complex. But yeah, we did. We had it somewhat under the radar compared to some other spots, but multiple times, early on and now, I think we're quite a bit coming out of it, much more than has been reported over the last month or two. But yeah, we had quietly had one of the worst outbreaks in the world outside of, kind of New York and a handful of other areas. And yeah, we also have some of the most medical, biggest medical community medical schools. The guidelines were relatively, we didn't necessarily have full on, like, don't leave your house, like infringing on personal liberty style tyranny. But yeah, it was pretty strict, and people it's an educated community around here, and people comply. It's like, I know it's different in other areas of the country, but you don't go inside a public building or, a retail business or anything without a mask on your face around here. It's like, I know other very different here, there, and everywhere. And nevertheless, it was what it, we had the results we did.
Yep, exactly. In chapter 6, you had put the point, you don't wear a mask for you, you wear it for others, right? That has been something that's been outspokenly said. And again, this isn't a talk about, you mentioned again, isn't about scientific literature suggesting the efficacy of wearing masks or wearing 2 or 3 masks nowadays it's being put out, but nor is it the argument against masks and starting a useless and idiotic rant on Facebook that's only going to create further division and not really actually get anywhere. That's not useful. No.
Right.
But where it really comes, again, understanding, well, is it the masks that's in terms of what's saving us and what's saving others? Isn't necessarily the masks that's going to do the job, or what rather be a proactive approach? Okay, let's follow the guidelines. We'll do what we're supposed to do, but we also can't leave out the fact about what are we doing for our own health. You mentioned following the guidelines. Here's a guideline, 86% that you include in the book, 86% of the 325 million in the US do not follow and adhere to the WHO guidelines for physical activity requirements on a daily basis. And again, it's well,
yeah,
you're right. There's so much gold information here, by the way. You guys got to read the book. There's a lot that we're just not able to cover now, but it's such a good point that, well, I think it's to understand, not from a political perspective, but I think it's something to consider. Well, what is the end game goal with what we're trying to do with this virus, right? We're trying to minimize the spread to get past it so we can resume normal and minimize death and injury and sickness from this virus. I think we all can agree to that. And nor would any of us want to do harm to others, nor, Dr. Davis, would you want to put any of your patients in harm's way. It's the first rule of healthcare is do no harm. So we understand, and again, we've been told the outside-in approach for what to do. Wear a mask, sanitize, just stay at home, don't interact with the environment. But we don't consider the other end of the spectrum, which is, well, what happens if we do get the virus? How are we going to best handle ourselves? How are we going to boost our immune system? And that's a critical component in terms of the overall spread of the virus, is how intact is our overall immune system. And this is something that's been talked about by Dr. Fauci, saying asymptomatic individuals are very significantly less likely to spread the overall virus. And so that's a key component in terms of spreading it to others and caring about our environment, is how healthy we are and doing it for ourselves. Let's see.
Yeah, I had something that I didn't set out to do initially, but it occurred. It's funny you bring that up, because I'd forgotten about some of that material that was in there in that chapter. But yeah, a lot of it was making the point that there is a real societal pressure around risk, exposure, and understandably, and the same thing exists and has always existed in our day-to-day behavior. And cited, it's not even new. It's easy a decade old, but research showing how your health outcomes are determined in a massive way by the people around you. So if I show up, and I'm showing up to chiropractic school, and Stephen Gage is my roommate in my first week in chiropractic school, well, I'm not going to, totally abuse my body living with, here we go, fired up young chiropractic student that's out charging out to make a difference. And people attenuate their activity based on what's around us. And so a point that I made in there is we do now and have always influenced each other around how we live and around our health in a huge way that goes way beyond what we've all focused on this past year. Around, okay, am I spreading a germ, and do I have exposure? Because that's an aspect we have, like our whole society, we don't go around kissing toilet seats for a reason. We all have our own, basic rules of hygiene. And once we have some details, we can say, okay, great, I'll do this and not do that, and that will be helpful. But outside, minus a big picture understanding of, oh, I actually modify my behavior around what the people around me do and what you do, and you do vice versa all the time. And why and what do we actually want to obtain? Then I think that all of those things, it's led to, very easy to find, the criticism of it is it's like, okay, I've seen it here in my own town. You watch someone, mask across their chin, smoking a cigarette, crossing the street. It's like, okay, well, what are we really trying to achieve here?
Right. Yeah. And you had mentioned something regarding our influence of sort of how we think about those who are around us. You added in here a study from Harvard University, and I just want to read this for the audience. And this is a quote from the article in your book. If your close friend becomes obese in a given time interval, there's triple the risk that you will follow suit, says Nicholas Christakis, who's a co-author of the study, and he's a professional medical sociology at Harvard Medical School. He goes on to say, before you know it, you have an obesity epidemic where we're all kind of gaining weight together, like a fashion spreading through society, rising in lockstep. The study's effects of this article just come down to the idea that thin people seek out other thin people as friends, while heavy people seek out other heavy people. In fact, what's going on is much more interesting according to the researchers. Heavy and thin people are causing their friends to become more like them. The reason people have such a powerful effect on each other's weight is hinted by one of the study's most intriguing findings, says Fowler. Friends who are hundreds of miles away from you has as much of an effect as friends who are geographically close. So obesity then doesn't spread among friends simply because they're hanging out together, going out to the Eames, eating the same places, going to the same bar, park, and running together. It's spreading through ideas about what appropriate behaviors are or what an appropriate body image might be. And we can kind of compare that to what goes on with this virus in terms of how we can easily follow suit without thinking about what we're doing. Right? You had mentioned again, and it's not criticizing the mandates or things of that nature. That's not what this is about, but it's just, I think we, the American people, have lost touch of what the end game goal actually is.
Right.
And again, I think that touch comes from, well, what can we do from the, it's how are we living, how are our bodies best functioning, and ultimately what can we do to best defend ourselves from the virus. I'll get into, when we're talking from this inside out approach, what are some ways? I mean, we mentioned, you talk a lot about it with the, when we go to the microbiome studies, the role of its health, we go into cardiovascular health, but what are just some overall things that you're seeing in your practice, perhaps, or just from your understanding and research that you've done for how we can benefit our inside out so we can be healthy and have a robust immune system?
Yeah, it's a great question. And probably if I had one thing to do over, I probably would have put more specifics. And I really didn't. I think that type of, sort of the health wellness book always has the final chapter, and it's about, okay, sleep, get your sleep, sure, reduce your stress, have a healthy diet, move regularly, don't abuse your body. And you know, like it almost felt cliche. Like I just wanted people to put people in this place of like, we have been obsessed over details and arguing, like you said, you know, I'm sure, you know, I'm sure it has happened and will happen. You know, people post something and they're trying to help, and the next thing you know, there's just in the middle of some giant public argument over something. And the details are extremely important, but in the context of where you're trying to get to. So I would say that's the first thing, is just understand that putting yourself and your health first is the most important. We have this thing where it's almost health by guilt, saying, okay, do all these things so that you don't affect someone else. And there's an aspect to that, but ultimately you're responsible for yourself, and no one is going to get an outcome for yourself as an individual more so than what your own choices are. And then from there, you know, I think what we've seen in our society, and I think there's this idea that doesn't get discussed very often, where it's popular now to say, okay, well, just focus on what you're good at. And that's true in a lot of ways. You know, if it's like professionally, absolutely, you know, personally, or maybe like in your, you know, social life or what you enjoy, there's so many ways where that is true. But when you come to your health, it's actually the opposite. And it's it's when you get sick or have a crisis, or ultimately when we die, it's the weak spot that gets you. And so most likely that's probably the best place to start, because it's the same thing, like as we talked about, you know, with this pandemic in particular, but like I cited, you know, multiple research studies where it's a fairly broad concept. It's where you're weakest, is where you're most susceptible. And so, you know, to some degree, I thought, you know, who we should have, you know, who should it be? You know, who should be the, you know, the fittest, smilingest looking guy to lead, like we need like Jack LaLanne out there right now to lead like a health revolution. And I'm like, you know, I don't have the cutest looking Instagram out there in the world, but it's like, we need this message needs to get out there for people. You know?
And I would propose, hopefully the goal would be that once we kind of come, I think some only good will come from that. I truly do believe that, as a man of faith. I always believe that the good will shed its stuff through. But I just think there's too much chaos and too much fear going on right now for most of us to see that. And it's sad to see a lot of suffering. And we talk about the main suffering from the pandemic. A lot of, and this isn't myself saying this, isn't you saying this, but a lot of the real detriment hasn't just been the COVID deaths, but it's been the other secondary effects from it. It's been from, you know, you look at all the job losses that have come. You look at all the division amongst family members in society. You look at depression rates, suicide rates, you know, addictions have skyrocketed, so many other things. And one of something that's really, truly, and I know you likely agree with me as well, is just the long-term effects of what are going to come from this. And in terms of our own health and how we view our external environment. You had talked, and there's a lot of studies in here that you had mentioned. We don't have a time to go through all of them, but you were talking about the Spanish flu back in 1918. And I do think historical perspective is a key, you know, to learn from. You look at the Spanish flu, 50 million deaths, more than World War I and all of the wars combined. The Spanish flu killed 3 to 6% of the global population. But there are a lot of studies that had come out, you know, in the mid to late 2000s, talking about, and you mentioned this all here in the book, with number one, you know, it shows the role and the influence of people's overall immune system and their susceptibility to the H1N1 virus. But also you had mentioned a key component in there as well, where people who were exposed to the 1918 virus, who were then now elderly in their elderly years in 2009, showed with the H1N1 virus that came around in 2009, they actually showed extreme resiliency to that virus. Like there was a measurable difference that was documented through research. And that's huge, because we always think older people are more susceptible, but yet those were found that those were exposed to the H1N1 virus in 1918 that had extremely resiliency to the virus. And they attributed that to the antibodies that were still within their immune system after all of those years. And you had also mentioned studies, and this has been well published and talked about now with the a lot of the soldiers. Of course, World War I is going on at the same time with that the Spanish flu was going around. That you would think that the soldiers who were fighting for long periods of time, you know, you have obviously tons of stress, they've been exposed to all sorts of illnesses and infections, would be more likely to get sick and die from the Spanish flu. But they actually showed the opposite. It was the soldiers that first went into combat that were getting sick and dying significantly more than the soldiers who have been there. And they attributed that to the fact that the soldiers who've been there longer have been more exposed to other, you know, they've been around the war, they've been exposed to more infections and things of that nature. And that actually showed resiliency to their immune system. So the thing is, we have to change the way that we look at bacteria and viruses in our environment.
Yeah, I mean, that's exactly what it was. You know, it was, you know, they had some protection from secondary infections, and it was counterintuitive, but it was the, you know, guys right on the fresh lines there, you know, right on the new on the front lines, rather, the fresh recruits that were just basically hardest hit of anyone, because they had the worst exposure to secondary infections and had the least resistance to it. And yeah, I just, you know, it was sort of I had another book project that I had probably about half finished, was working on, put it on hold to write this book, and it was really a timely thing. And the idea of like, well, maybe this will be, you know, short term and just disappear and we won't ever hear about it again. But I really thought that with the amount of change that society was going through, that I think that, you know, there's people that are, you know, young kids now that are going to look back 10 years from now and come across it and say, you know, here's a whole new perspective on how my whole life got turned upside down. And like you're saying, there are people that are having, you know, massive stress, you know, either just through the isolation or, you know, this sort of guilt and fear of causing nothing but problems for other people. And I think that has, you know, there will be people that, you know, years from now that will need that sort of eye-opening perspective to say, okay, we were really told half a story, I think. And so I really appreciate you having me on. This is, I think, a great thing, and I'm excited you're joining the profession.
Yeah, I really appreciate that, Dr. Gonstead Davis. This has been a great conversation. It's exciting. Yeah, you say excited for me to join the profession. It seems like, holy crap, I'm at like the end of the road. This is coming up. This is gonna be a legit thing. But this has been great, and we didn't even touch again. There's a lot we didn't get to in the book. There's so much incredible information, a lot of studies, and just there's really good words of wisdom in this book. I really encourage all of you to get this book and read it, and just really take the ideas in. It really is a warming. To me, reading it, it really puts things in greater perspective and puts you at a greater sense of peace and more of a sense of control in your life, which I believe is a human value and human right, especially in this country. As America, we are the land of the free and the home of the brave, and that comes from within, not necessarily from outside institutions. So Dr. Jesse Davis, has been a pleasure. Where can people, obviously they're going to get the book, and I'm going to link that again down in the show notes to check that out. I know you're also a big advocate for donating back to the Gonstead Clinical Study Societies, back to the Gonstead Chiropractic as a whole. You're very active there, but where can people follow you, get in touch with you, and learn more about what you're up to?
Yeah, great. Yeah, Stronger Than You Think is on Amazon. It's Kindle and paperback. Easiest place to find it. You can just search it. And also have had good interest from chiropractors looking to bring it into their offices as well. If you want, just shoot me a message. I'm pretty accessible on Facebook, so just look me up on there. As of right now, is probably the easiest place to do it. And yeah, love to hear what you guys think about it. Leave a comment below. We're happy to do it again, Stephen, and we'll leave your comments. Let us know what you'd like to hear about for next time. We'll jump on again sometime.
Yeah, that sounds good. All right, it was a pleasure having you on, Dr. Davis. We'll talk soon.
Have a great one, Stephen.
Yep. Hey guys, I hope you enjoyed this interview. If you did, give it a like, and I'm curious what your biggest takeaways were. Leave those in the comments below. If you're new to this channel, welcome, and if you want to see more videos regarding chiropractic, health, and everything in between, consider subscribing. Thanks guys, and I'll see you in the next one.